In this lecture, we are going to talk about two important branches of pharmacology, that is pharmacokinetics and pharmacodynamics. So, pharmacology is nothing but study of drugs. So, coming to the pharmacokinetics, it's nothing but what body does to the drug. So, how our body process this drug is called pharmacokinetics, and pharmacodynamics is what drug does to the body. So, what effect the drug gives to our body is pharmacodynamics. So, pharmacokinetics involves these four phases. It passes these four phases to give the effect. It's absorption, distribution, metabolism, and excretion, which are referred as ADME. Coming to the absorption, absorption is nothing but the amount of drug that enters the systemic circulation in its unchanged form. So let's see, when you take drug in its oral dosage form, when you take any drug orally, it might be tablet, capsule or anything, it enters the stomach and it enters the small intestines. So through this GIT, it gets absorbed into the liver first. From there, from liver, some amount of drug gets metabolized in the liver before it enters into the heart. So this is called as first pass metabolism. Before the drug enters the systemic circulation, some amount of drug gets metabolized. So from liver, through this hepatic vein, the drug enters into the right side of the heart. From right side of the heart, drug enters into the lungs. In lungs, blood get purified. It enters into the left side of the heart. From left side of the heart, the drug enters into the systemic circulation. So this entire process is called as absorption. The extent of drug in the systemic circulation is referred as bioavailability. In case of oral drugs, bioavailability, which is represented by F, in case of oral drugs, bioavailability is 50% because half amount of drug is metabolized in the liver. But if you administer drug through IV route, so if you are injecting into the vein, it bypasses this step. It bypasses this first pass metabolism. So 100% of drug enters into the systemic circulation. So for IV route, the bioavailability is 100%. For the drug to be absorbed, it must cross several barriers, biological barriers. There are epithelial cells or endothelial cells or anything. We all know that our body is made up of cells. So these cells are made up of cell membranes. So for the drug to be absorbed, the drug should cross the cell membrane. We all know the cell membrane is a biphospholipid layer which have embedded proteins. They are called integral proteins. Some proteins stick to the surface of the biphospholipid layer. They are surface proteins and membrane bound proteins. If they are covalently bound, then they are membrane bound proteins. If they are not covalently bound, they are surface proteins. There are many mechanisms by which the drug is absorbed. Passive diffusion, pore transport, carrier mediated diffusion, active transport, endocytosis. Many drugs are absorbed by passive diffusion. In passive diffusion, drug moves from one side to the other side based on concentration gradient. So from high concentration, the drug enters into the low concentration gradient. By this method, drugs are absorbed in passive diffusion. In pore transport, the movement of molecules occurs through the protein channels. We already saw the structure of cell membrane. So, through those protein channels, drugs pass from one side to the other side. In carrier mediated diffusion or transport, the movement of molecules occurs with the help of carrier protein across the membrane. So the carrier protein takes the drug from one side of the membrane to the other side. In active transport, the drugs pass with the help of carrier protein across the membrane utilizing energy. So here ATP is required, energy. ATP is required for the transport of molecules from one side of the membrane to the other side. And endocytosis is the movement across the membrane by pushing phospholipids, cholesterol, by forming a vacuole. So what happens here is it entraps the drug molecule and it releases the drug molecule on the other side.